Good afternoon, and welcome to the 2024 budget hearings for Franklin County, Ohio. The next agency we will hear from is the Franklin County Office on Aging.
Hey, we start today with some breaking news. The Franklin County Office on Aging announced that residents seeking their services is on the rise. This year alone, 2023, the Franklin County Office on Aging has served over 90,000 seniors, delivered over 1.4 million meals, and provided over 2,400 home repairs. They've also connected over 200 caregivers and 84 kinship caregivers to various support services. And Adult Protective Services has screened in over 1,900 cases, helping our Franklin County seniors to remain safe. The agency has also successfully launched the Bridge Team that provides on-site case management at 3 different locations: the Whitehall Senior Center, the Whitehall YMCA, and the Emergency Department at OSU East Hospital. And speaking of OSU, let's turn it over to Caroline, who has an update on sports.
In the spirit of staying active and engaged, over 200 seniors came out to the Senior Wellness Jamboree, which included activities such as walking, aerobics, and dancing. I must say, kudos to all those seniors who showed us that age is just a number. And speaking of numbers, this year's Clippers game drew a crowd of over 1,100 seniors and was sold out. The highlight of the day belonged to Director Wingo, who delivered the ceremonial first pitch as the agency's first African-American female director. I think it's safe to say that that event was a home run success. However, in a fun twist of events, some familiar faces from the Clippers were spotted at another Office on Aging event. Amy has more on that story.
Columbus Clippers mascots Lucille and Crash made an appearance at the Office on Aging's first ever Spring Forward event and joined in on the fun activities, including art lessons from the Ohio Alliance for Arts Education, who received funding to provide seniors with free art classes. The artwork created from those classes is currently on display at the Office on Aging, brightening up the walls of Memorial Hall.
Hi, it's Larice with a quick weather update. In response to an intense heat wave, the Office on Aging and AEP Ohio joined forces to distribute 5,000 emergency kits to seniors and created an awareness video for National Preparedness Month. In addition, over 800 box fans were also given to seniors to help them stay cool this summer. Stay tuned for more news you can trust after the break.
Good afternoon, Commissioners. I am Shonda Wingo, Director for the Franklin County Office on Aging. Joining me today is Chief Financial Officer Larice Collins, Assistant Director Caroline Rankin, and Assistant Director Barb Sullivan. The Office on Aging is a centralized gateway to a variety of programs and personalized services tailored to older adults, dependent adults, and their families, enabling them to maintain their independence. The Office on Aging is enhancing its programs and services aimed at improving the lives of older adults. These initiatives have not only promoted the physical and emotional well-being of seniors, but have also sparked a sense of community and engagement among them. Despite facing various challenges, which we will cover later in our testimony, our steadfast commitment and innovative problem solving have allowed us to adapt to many of these obstacles. We are determined to not only overcome these challenges, but to thrive in fulfilling our mission of serving and caring for our seniors. In 2024, we anticipate generating approximately $54.9 million in revenue. This projected revenue will equip the Office on Aging with the necessary financial resources to bolster healthy outcomes through the implementation of home and community-based programs specifically designed to tackle the social determinants of health and align with the objectives set forth in the Franklin County Rise Together Blueprint. We will also continue to factor in insights collected from the 2021 Regional Assessment Survey on Aging and the valuable lived experiences shared by our residents. By doing so, we aim to continually refine our approach and better cater to the evolving needs of the senior population in Franklin County. At this time, I will turn it over to our Chief Financial Officer, Larice Collins, to talk about the numbers.
Thank you, Director Wingo. Great afternoon, Commissioners and County Administration. My name is Larice Collins, Chief Financial Officer for the Franklin County Office on Aging. For 2023, we are projecting approximately $40.8 million to be expended by the Office on Aging and Social Services to facilitate the delivery of essential programs. A substantial portion of that budget, an estimated $30 million by the end of the year, is for expenditures for board and care services. From that amount, our projected costs are as follows: over $12.4 billion for home delivered meals, more than $4.6 million for transportation, over $3.4 million for respite care and homemaker services, and over $1.5 billion for emergency response systems. In addition, social services includes over $5.3 million for case management services and roughly $3.3 million for home repairs. Adult nutrition, incontinence supplies, and durable medical equipment cost us over $1.9 million. The next largest part is $9.3 million for personnel services in the amount of $6.2 million, and fringe benefits in the amount of $3.1 million, followed by $3.9 million for grants, including ARPA funds. For 2024, our agency proposed budget expenditures are approximately $63.7 million. This recommended budget includes roughly $9.7 million in personal services and fringe benefits to support our agency staff. Our staffing level target for 2024 is 120 full-time equivalents, or FTEs. The 11 FTE increase is due to a request to add 2 training officers, a caregiver support coordinator, and 8 case managers. This includes expanding our hospital care transition pilot by stationing 2 more case managers at emergency departments at a second local hospital to aid high-risk seniors and prevent hospital readmissions. Additionally, 2 new case managers will join existing staff stationed at community centers in Franklin County, expanding our presence to a second community location. The 2024 budget also allocates $3.2 million for materials and services and capital outlay, as well as $4.2 million for grants to provide specialized services to older adults. However, the biggest portion of our recommended budget is $46.6 million, which is reserved for social services to directly assist our senior population and caregivers. This includes services such as home repair modifications, transportation, nutritional supplements, home delivered meals, and more, along with community support, outreach and specialized services, case management, public information, safe housing, and protective interventions. At this time, I will turn it over to Assistant Director of Support Services, Caroline Rankin, to highlight our agency collaborations.
Thank you, Larice. Good afternoon, Commissioners. My name is Caroline Rankin, Assistant Director of Support Services for the Office on Aging. Our agency collaboration goals enable streamlined referral process between our agency, enhance outreach efforts, and accessibility to all FCOA home and community-based programs. Over the last decade, our agency and the Veterans Services Commission have partnered closely to support elderly veterans in Franklin County. We have an MOU in place enabling VSC to allocate funds for essential home repair and modifications through the agency's contracted providers. Likewise, our joint efforts facilitate the Veterans Services Commission provision of funding for emergency response systems, boosting safety for eligible veterans at home. Currently, the Office on Aging serves over 2,200 veterans and/or their spouses. Our community outreach efforts were expanded in 2023 through collaborations with The Ohio State University Wexner Medical Center and the City of Whitehall. With OSU Wexner Medical Center, we placed 2 full-time community case managers at OSU East Hospital Emergency Department, focusing on older adults upon admission. We also partnered with the City of Whitehall to station a case manager at the Whitehall Senior Center and the Whitehall Community Park YMCA, offering on-site case management services. The partnership with the City of Whitehall led to us hosting our first ever Spring Forward event, which drew over 300 residents. The event not only showcased our initiatives, but offered opportunities for engagement in fitness activity and educational sessions. The event sparked a partnership with the Ohio Alliance for Arts Education and secured grant funding to provide seniors with free art classes. The art has not only brightened the halls of our lobby, but has also enriched seniors' lives by offering mental stimulation, emotional well-being, social interaction, improved motor skills, and a sense of accomplishment. In 2023, we maintained our partnership with the Columbus Clippers for our 21st annual Senior Day, drawing a sold-out crowd with over 1,100 seniors. The highlight of the day was our very own Director Wingo, who had the honor of delivering the ceremonial first pitch, which symbolized a celebration of her historic role as the agency's first African-American female director. We continue to collaborate with the Columbus Recreation and Parks Department to host over 200 seniors at the Senior Wellness Jamboree, promoting physical activity and for increased energy, mood, and overall well-being. We proudly sponsored the 4th annual Caring for the Caregiver Expo, hosting over 400 caregivers this year. A 2021 report from AARP's Public Policy Institute revealed Ohio caregivers provide $21 billion in uncompensated care, a 4.2 million increase from the 2019 report. Recognizing caregivers often prioritize others over themselves, the Expo provided an opportunity to say thank you and a well-deserved day of rest, relaxation, and rejuvenation, freeing them momentarily from the challenges that come with being a caregiver. In September, we collaborated with Trebien Enterprise to sponsor Seniors in Technology, which aims to bridge the digital divide among our senior population by providing tailored technology resources, training, and support. The COVID-19 pandemic emphasized the importance of technology for older adults and according to the National Center for Biotechnology Information, smartphone ownership among those 65 and older has risen from 57.6% in 2019 to over 65% in 2020. However, in addition, trying to learn how to use these devices is an added barrier among older adults. Our agency knows that seniors are the ones who could benefit the most from learning how to use technology, and therefore, we have been working with our grant partners, including Central Community House and NCUS Tech, to tackle the digital divide by providing tech programs tailored for older adults. It is through these collaborative efforts that we have successfully provided digital literacy support to more than 184 seniors. In 2023, we also launched a new collaboration with our grant partners to introduce networking meet and greets throughout Franklin County. Our inaugural efforts included partnering with OSU Extension and the Mid-Ohio Food Collective to host quarterly networking events among our 31 grant partners. The primary purpose of these networking events is to nurture and expand relationships among all of our partners, while simultaneously enhancing scope and accessibility of services for seniors in Franklin County. Lastly, our organization remained committed to providing COVID-19 vaccine booster clinics to older adults in 2023 through a partnership with Franklin County Public Health and Primary One Health. Guided by data from the Equity Mapping Tool report, we targeted specific zip codes including 43207, 43211, and 43223, which were identified as having the lowest vaccine uptake in Franklin County. These targeted efforts reinforced our dedication to health equity and enabled us to efficiently support older adults in their local communities. Thank you, and at this time, I will turn it over to Assistant Director of Operations, Barb Sullivan, to talk about our accomplishments.
Thank you, Caroline. Good afternoon, Commissioners and County Administration. I'm Barb Sullivan, Assistant Director of Operations at the Franklin County Office on Aging. Today, I'm happy to talk about our agency's accomplishments. In early 2023, our agency underwent significant restructuring, consolidating non-traditional case management responsibilities into a unified body called the Bridge Team. Thanks to the Bridge Team, our agency successfully launched the pilot program in collaboration with OSU Wexner Medical Center for Hospital Case Management. Through engagement and assessment for older adults admitted through the emergency department, it was identified that 85% of these seniors had not previously accessed our services. This program has been pivotal in connecting more seniors to vital resources designed for those with medical needs when they return home. In our partnership with the City of Whitehall, we have a case manager on site between two locations, the Whitehall Senior Center and the Whitehall Community Park YMCA, to provide on-site case management services and streamline services to the older residents and the kinship caregivers. This partnership allows us to provide support and connections for older adults, kinship families, and caregivers. The Senior Options Program has experienced remarkable growth in recent years, serving 11,755 seniors in 2022. As of November 17th, 2023, the program has already served over 14,600 seniors in Franklin County. This expansion reflects our success in addressing the challenges outlined in the Central Ohio Regional Assessment on Aging Survey, as well as engaging the public through diverse outreach efforts. In 2023 alone, We participated in over 400 community events, significantly surpassing the previous year's efforts, and reaching over 3.1 million individuals through our social media, advertising, media appearances, sponsorships, and word-of-mouth recommendations. These initiatives have also helped us transform how Franklin County perceives the aging population. By collaborating with local influencers known as the 614 Golden Girls, we've reshaped the narrative around aging through their engaging TikTok videos. Their content communicates the idea that growing older can be cool and fun, resonating widely and becoming some of our most engaging and impactful social media content. This year, our Kinship Support Program secured funding from Franklin County Children's Services to help as many as 200 children residing with kinship caregivers. Unlike the previous caregiver grant, which had limited funding and focused solely on the caregiver, this new support allows us to assist both caregiver and child. We provide crucial items like beds, clothing, and appliances alongside rent and utility aid, addressing immediate needs and enhancing support for the children in kinship care. Partnering with AEP Ohio, we secured 5,000 emergency kits that contained Mylar blankets, hand crank radios with lights, and tips for handling severe weather and power loss. We distributed these kits through 12 community pop-up events in zip codes like 43207, 43211, 43213, and 43229. Delivery of the bags was provided to those who could not pick one up. To further enhance the readiness of our senior community, we collaborated with AEP Ohio and the Central Ohio Area Agency on Aging to create an informative video for National Preparedness Month, tailored for older adults and those with disabilities, empowering them to be better prepared for when disaster strikes. Annually, the Franklin County Office on Aging secures grants to enhance the well-being of older adults. In our current levy cycle, we've revamped our approach, prioritizing health-focused initiatives addressing social determinants. Of our 48 programs, 19 focus on social and community context, 14 on healthcare access and quality, 8 on economic stability, 5 on neighborhood and built environment, and 2 on education access and quality. Additionally, with the allocated ARPA funding, we awarded grants to new programs and partners: Central Community House for their Intergenerational Technology Collaboration Project, Technology Access Project, or TAP, and NCUS Tech, which aims to empower seniors with digital skills for various tasks and online engagement. Lastly, our third grant partner to benefit from ARPA funding is the African American Alzheimer's and Wellness Association, which offers the Community Navigation Program. This invaluable service is delivered free of charge and is culturally sensitive, catering to underserved populations in Franklin County. The program deploys community health workers trained to address the specific needs of individuals and families dealing with Alzheimer's disease and other forms of dementia. This year, the program has shifted its focus to include our new American communities residing in Columbus. In a remarkable collective achievement, I'm delighted to report that our grant partners have exceeded their annual target for serving seniors. They've served over 74,000 seniors benefiting from their collective initiatives. Finally, in 2023, our agency prioritized staff training by offering over 170 diverse training opportunities covering leadership, management, wellness, diversity, equity, and inclusion, and more. These sessions aim to foster individual career growth while strengthening our agency's overall success and adaptability. I'm pleased to share that our staff engaged in over 790 training sessions, reflecting our commitment to a dynamic and forward-thinking workforce. I will now turn it back over to Director Wingo, who will talk about our challenges.
Thank you, Barb. While we take pride in our numerous achievements in 2023, we acknowledge that there are still challenges awaiting us in 2024. Senior Options was established 31 years ago when those who were aging in place were born in or prior to 1933 and among the greatest generation and the silent generation. This is noteworthy as research shows seniors born within these generations had more resources than generations to follow. This is largely attributed to the financial characteristics of each generation. According to the Stanford Center on Longevity, the baby boomer generation is not only the largest in terms of our aging population, but also in a worse financial position than earlier generations and do not have comparable or better wealth accumulation in terms of home equity, workplace retirement accounts, individual retirement accounts, financial wealth such as checking, savings, stocks, and bonds. This presents a challenge to providing services for our seniors as many do not have the available resources to successfully age in place and must rely on programs such as Senior Options to meet their needs. The aging population continues to be the fastest growing population as the last round of baby boomers turned 60 in 2024. And the first round of Generation X turned 60 beginning in 2025. The demand is greater than the resources available. A persistent challenge we continue to face is the workforce shortage, particularly in the home care sector. According to the U.S. News and World Report, between 2013 and 2019, the number of available home care workers for every 100 patients in need has fallen by nearly 12%. Unfortunately, the scarcity of available home care workers has posed difficulties for our agency in maintaining crucial services such as homemaker, personal care, and respite care for our senior residents. To address this challenge, we've taken steps to revise our contract regulations related to these services and are actively developing a new initiative that allows contracted providers to enlist family members and friends to provide these essential homemaker services. Internally, our agency is also contending with a workforce shortage. Due to the ongoing growth of the senior population, which is now 18% of the county's total population, and the expansion of our services, there has been a significant surge in enrollment demand, hence the need for additional case managers. The average caseload per case manager is set to increase from 129 in 2021 to an estimated 200 by the end of December 2023. It's worth noting that the industry standard recommends a caseload of 135 cases per case manager, and research has shown that higher caseloads place a strain on the workforce, negatively impacting performance and retention efforts. Additionally, more manageable caseloads have demonstrated improved outcomes for our seniors. Our agency is currently tackling a significant challenge related to the increasing number of referrals for the services offered through our home repair program. Specifically, there is a notable uptick in the demand for home repair services, but we're encountering difficulties in securing providers to fulfill the necessary repairs. This year, we have seen a decrease in the availability of our contracted home repair vendors who are also contending with their own workforce shortages. Consequently, these factors contributed to an extended wait time for our seniors to have their repairs completed. To address these issues, we're exploring innovative strategies. One solution involves structuring multiple home repair contracts for specific services such as moving and packing, heavy cleaning and biohazard cleaning, general minor home repair, and pest control services, each covered in separate contracts. This approach allows us to seek additional vendors in areas of need without disrupting service delivery in other areas, as would happen under a comprehensive contract. A second solution entails engaging grant providers for support. For example, to meet the demand for lawn care services as part of our home repair initiatives, we're exploring potential grant partnerships to provide a year-round lawn care service in 2024. This not only addresses seniors' yard maintenance needs, but also fosters intergenerational relationships by connecting them with students aged 11 through 17 through this program. Furthermore, we aim to enhance current programming through the Neighbor Helping Neighbor approach utilized by the Greater Columbus Network of Villages and support the expansion of programs provided by At Home by High and the Clintonville Resource Center. By bolstering these existing programs, we can help our grant partners grow their initiatives and provide year-round assistance to more seniors in Franklin County. According to the U.S. Department of Agriculture, all food prices are predicted to increase by 5.8% in 2023, followed by 2.2% in 2024. This upward trend in grocery costs place additional strain on older adults with limited incomes. Feeding America's State of Senior Hunger reports that in 2021, 1 in 14 seniors aged 60 or older experienced food insecurity. Looking ahead to 2050, it is estimated that the senior population will reach approximately 104 million aged 60 and above. If the current rate of food insecurity among seniors persists, this would translate to over 7 million seniors grappling with food insecurity. Given that food insecurity has far-reaching consequences on aspects of health such as nutrition, and considering the continuous growth of the senior population, it is evident that food insecurity will remain a persistent public health challenge for years to come. We are witnessing this direct impact of food costs through our home delivery meal program. Up to this point, our agency has provided over 1.4 million free home delivered meals to our seniors in Franklin County. This surpasses the total of 1.2 million delivered meals in 2022. The significance of our agency's unwavering commitment to free home delivered meals to seniors cannot be overstated, as it can mean the difference between having food on the table and going hungry. We are also in the early stages of forming a collaboration with one of our grant partners to launch a pilot program for grocery deliveries to the seniors we serve. During our Hope campaign, 48% of the residents we surveyed expressed interest in grocery delivery services, all of whom reside in food desert zip codes. By piloting the grocery delivery service, we will be addressing two pillars of the social determinants of health: economic stability and neighborhood and built environment. Over the past 5 years, our agency has noticed a significant rise in referrals and cases being considered for investigation by Adult Protective Services. Among the older adults in these cases, we observed a noteworthy proportion with unmet mental health needs. This is oftentimes because they're not connected with mental health resources or unwilling to engage with mental health providers to access necessary services. This year, 20% of all APS referrals received indicated that the adult has mental health issues. Unfortunately, linking older residents with appropriate services is becoming increasingly challenging due to the limited availability of professionals who accept Medicare or Medicare Advantage plans. While APS does not offer long-term services, we are part of the Access to Wellness group through Adam H. that focuses on residents with mental health and homelessness by collaborating with various community-based agencies like Mental Health America, who specializes in providing ongoing support and case management for our seniors. Lastly, it's important for me to address the issue of affordable housing, a challenge that is felt by many within Franklin County. We know it's important for seniors to remain in their home as they age. However, with limited income and the increase in housing costs, the dream of aging in place is becoming challenging. The shortage of affordable housing and easily accessible housing places a significant burden on both our older adults and kinship families. According to the 2021 Central Ohio Regional Assessment on Aging Survey, 60% of older adults in Franklin County reported that they spent at least 30% of their income on housing and utilities, with 19% reporting that they spent more than 50% on housing and utilities. With over 60% of the adults we serve being renters, seniors are grappling with stagnant incomes while facing ever-increasing rental costs they simply can't afford. Here at the Office on Aging, we know it's a collective responsibility to ensure that older adults receive the support and assistance they need to prevent them from falling into homelessness. Thus, our agency will remain steadfast in providing funding and working with partners that specialize in securing affordable and safe housing for seniors. In closing, I could not be more proud than I am today of the Franklin County Office on Aging staff. It is without their unwavering commitment, we would not be able to serve and do the great work that we do every day. The Office on Aging is excited to embark on the new and innovative programs and services that enhance the lives of older adults. We take immense pride in the achievements we've accomplished as an agency, and I am genuinely excited about the opportunities that await us in 2024. While we understand that the challenges faced in 2023 may persist into 2024, alongside the emergence of new challenges, we're eager to continue our work in providing support and care for the seniors, caregivers, and kinship families of Franklin County. Thank you, Commissioners, for your time today. We are available to address any questions you may have concerning our testimony and the proposed 2024 budget.
Thank you, Team Office on Aging. We will now take questions from the commissioners. Commissioner Boyce, I see your hand raised, sir.
Yeah. Thank you, Administrator Wilson. And I want to thank the Department of Aging for a very thorough presentation, a very thoughtful presentation. I feel excited about the work they're doing. That's just important. The seniors are one of the most important sectors of our population and segments of our population. And I think this budget illustrates our commitment to that. That being said, given that they're levy-funded agency and it have somewhat of a supplemental fund from the general fund, talk about, and I know you kind of, as from a commissioner standpoint, I won't speak for my colleague, but for me, it's a lot to decipher when you all are reading through all those such good stuff, or you're trying to zero in on it, even though we have a budget document. And I've got some follow-up for you later, but kind of go through it fast. So if you said this, forgive me, but you indicated a increase, or maybe it's just in the budget document, increase in your supplement from the general fund, given that you're a levy-funded agency. Can you just zero in on that number? And it seems like it's a little larger than usual. And if you kind of just highlight kind of what's going on there, that'd be great. And then I've got a follow-up question, Administrator.
Thank you.
Okay.
To make sure I understand the question, are you asking about the significant increase in our budget?
Yes, but specifically around the general fund appropriation as opposed to the levy.
Okay. Larice, would you be willing to take that for Commissioner Boyce?
Yes, and I do agree. Thank you, Commissioner Boyce. When we take a look at what happened, if you take a look at what the previous budget is versus this year, it's a huge increase that we honestly were just not able to forecast into this next cycle. I'll tell you, a part of it is our increase in our client enrollment was growing. In a matter of 4 years, it was 20%. But in a matter of 11 months, now 12 months or 11 months, we've had an enrollment growth of 28%. And so when we were basing the budget from a levy standpoint, we were taking all the cost of services and saying on an average cost, it's going to cost us about $3,600 per client, and we can seek to, we can take on this many clients. But what we weren't able to really forecast completely was the cost of the items that were going to go up. And so that left us kind of in this stage where you necessarily don't want to stop where you're going, but you just have to make some adjustments to that. And so that large gap is due to the cost of services. And a lot of things happen in these costs of services. Not only the home repair costs went up, because now an average home repair cost is about $6,000. When you take a look at what we're doing, our average home repair cost for our clients is about $4,000 to $5,000. What else happened to us is our nutritional supplements, where before in the previous contracts that we were doing, an average case of a Boost product or Ensure product or energy drink or a Boost would cost about $40 a case for 24 cases. In this case, because we allowed some substitutions, because again, we did not want clients to be out of product, we are now paying $80 a case. So a lot has happened and transitioned in this small amount of time. We are watching it, keeping an eye on it, making some changes that we have to make. They are difficult, difficult decisions to make. However, we're trying to, at the same time, we want to stay within what we're spending in the levy, but we're finding out at the growing pace of every single 60-plus-year-old that is retiring now, that not only just retiring, that are taking care of other family members that are in a kinship space. It's more growth than we could think of at this time, and it is growing at a higher percentage every year, to a part we may need to just take a drill down and take a look at a lot of what we're going to do over the next couple of years in order to meet our balance or our budget requirements. Hope that answered it. If it did not, I can more into
I
that.
think it would be helpful if maybe you put together just something that just kind of illustrates it in kind of a spreadsheet form. Again, I support the work that you all are doing. It seems to be great, and it's, to me, one of the more critical areas we have. So I actually like to see growth in this area in terms of the budget, but I want to understand it a little deeper.
Absolutely, I'll get that to you.
Great. I don't have any other questions. She kind of answered it in her response. Thank you.
Okay, thank you. I see you, DCA Bivens. Yes, I know when we look at the levy plan did not contemplate the growth over the last 3+ years going into this year, because of conscientious efforts to deal with a vulnerable population that has become more vulnerable as the pandemic played out. And we added a lot of enhanced services and seeked out partnerships. And when you look at the $9 million that this budget recommendation includes over the levy plan, what drives it is social services. And that's delivery of services to our vulnerable residents in need. And we know that a challenge is right now, we're like right aligned with the levy plan as it relates to ending cash. So we're gonna have to sort of evaluate. I see 2024 as a year of evaluation to determine if we can maintain where we are, or if demand takes us even higher. So that's I want to, as an administrator, make sure that I'm working with you all in looking at the choices, because as the commissioners have been stating for some time, this is not an area where they are interested in scaling back as far as what the need is of these other vulnerable population that's 60 and over in our county. So we're going to have to look to partnerships like the state grant we were able to receive, and try to look for some opportunities for revenue to come from places like Franklin County Children's Services to help support us in this quest to expand services. Because I, for one, is excited about the fact that we're gonna, in this budget, expand to another community and be closer to whether the seniors are to be able to serve them. DCA Bivens?
Thank you, County Administrator. Director Wingo, does the one door assist in offsetting any of your barriers, whether it be service delivery or fiscal?
In some instances, yes. When I look at the needs of our aging population, oftentimes people don't commonly recognize that this is a family. Aging is more multi-generational than ever before. There are over 283 young people living with a grandparent, with about 30,000 of those grandparents being responsible as the primary caretaker for young people, and they're 30% below the federal poverty level. So when we think about the Health and Human Services agencies, our families engage with every single agency, whether it be the youth of incarcerated parents, whether it be a grandparent that is, has an informal placement that wants to secure child support, you name it, it definitely helps in some of those instances, especially being able to pull on some of those financial resources because our levy dollars are so restricted to seniors that are 60 and that live in Franklin County. But when you really think about those numbers that I just quoted about our multi-generational households, that funding structure prevents us from really being able to provide those supportive services that seniors need to stay in their homes. And so absolutely, there is strength in partnering with Health and Human Services. And alternately, on the other side, oftentimes those kinship families come through those doors. And my brothers and sisters at Health and Human Service agencies don't have funding structures that allow them to support the whole family household as well.
Thank you, Director Wingo. And then my next question is just really quick. When you talked about the barriers for 25, I think there was nurse practitioner deficit. I think there was STNA deficit. I think I saw some lab technician deficit. Is there a way to work with your sister agencies to implement or to mitigate some of this for Franklin County, whether it be workforce programs? And also, is there an opportunity, do you need assistance in advocating on a state, local, or national level for probably increased funding for some of these agencies, particularly for like a home health agency, so they can increase their funding? There's a deficit. There's a reason why there's a deficit in those areas, just like there's a deficit in our areas.
Yes. So as I mentioned, one of our strategies internally, because we know that we have so many non-paid caregivers in Franklin County, I myself am one of them, that a lot of our caregivers are in positions where they could enlist with our contracted partners and become paid caregivers. That is an out of the box, new to Office on Aging strategy to try to accomplish backfilling some of those roles. But I absolutely think, and thank you for that, because we hadn't thought of that, definitely a workforce program in collaboration to support some of these programs, I think is a critical need. We're at the rate that seniors are aging every day, Franklin County Office on Aging is going to need the collaboration of anyone in this space to serve all of the seniors that are in need. There's 250,000 seniors in Franklin County, and only about 6% of them are interfacing with senior options. When you look at the hospital data, 85% of those seniors that have come through those doors have no connectivity to us whatsoever, but they're in need. I'd like to share lived experiences, and through that project, there's one instance of a senior who was having a medical crisis. He lived in an apartment, didn't have a working phone. So he had to move from his apartment down to the lobby to have the medics called. Upon arrival at the hospital, he shared that he hadn't eaten in 3 days. And so having our case manager there and that lived experience, we were able to connect that senior with free delivered meals, emergency response systems, and transportation to mitigate that going forward. Unfortunately, that is not a unique circumstance for our seniors. So it's going to really take the hands of everyone. And I do think that it's time to start having national conversations. Whenever I am in attendance to a lot of conferences, you may hear a snippet of seniors in the growing population, but it really deserves its own place because the needs of seniors and their families are so different. And a lot of it is marked by the generational differences. When I mentioned that, we are currently serving 2 generations, imagine in 2025, we'll be serving 3 generations, and each generation has a different set of needs and a different set of characteristics that will really reshape what aging in place looks like. I know as of today, when we think of aging in place, it is more so the philosophy of keeping seniors from going to nursing homes, but it really needs to consider all of the factors that our seniors are encountering on a day-to-day basis. So absolutely.
Thank you, Director Wingo. And I would like to ask all of our commissioners, maybe there's something that we can put together, particularly I know Commissioner O'Grady sits on the National Association of County Boards, to create that space if it doesn't exist already. But I would also ask the county administrator to support you know, our efforts in trying to put together some type of framework presentation for particularly your levy board, because you started this conversation about 30 years ago. This agency was created for seniors who had resources. That has changed. So
Yes.
to make things more relevant, multi-generational families, I would, I think from this budget presentation, we need to keep those things before your levy board as much as possible. And I yield, County Administrator, back to you.
Thank you, Deputy County Administrator Bivens. Do we have any additional questions from the Board of Commissioners? If none, this will conclude Office on Aging's testimony. Thank you all for providing a thorough review of all of the work that you all do every day on behalf of our senior residents. I want to thank all of the HHS agencies for their budget presentation today and accompanying videos. You all are very valuable to our efforts around the poverty blueprint and all the goals contained within that poverty blueprint. You all have really banded together as agencies, brother and sister agencies, and it's a beautiful sight to see, and I expect it to continue to flourish under DCA Bivens' oversight.
Thank you, Administrator Wilson, and thank you, Commissioners and County Administration for all of your support. We wouldn't be able to do this work without any of you. Thank you.
Office of Management Budget.
Yep. And that is our last presentation for today. Before we end today's session, a reminder that the next budget hearing will be on Thursday, November 30th. The budget hearing will be on Zoom starting at 1 o'clock with presentations from our centralized service agencies, including the Purchasing Department, Fleet Management, Office of Diversity, Equity, and Inclusion, Public Facilities Management, and Human Resources. And if there are no other comments or questions, then that will conclude today's budget hearing. Thank you.